Hi, I'm Sharon Mullenkamp, the Director of Mercer Health Home Care and Medical Equipment. We often get questions about what is home care or what kind of medical equipment do you have? Our goal at Mercer Health Home Care and Medical Equipment is to help you stay active and happy in the comfort of your own home. That's the real goal. So to do that, the Medical Equipment Office offers a variety of medical equipment and medical supplies. Some things you may need short-term, other ones you may need long-term. You may need just some medical dressings or some crutches for 2 weeks, or you may need that wheelchair just for a long weekend, or you have a relative coming in town. Or you may need some long-term things like ostomy supplies or catheter supplies or a CPAP machine, which can really affect your general health overall. In the Mercer Health Medical Equipment Retail Office, you can see we have a variety of bathroom aids. We have the shower benches, the toilet seat risers, we have ambulatory aids such as canes, crutches, walkers. We have different convenience store items such as the medical bandages. We have the automatic blood pressure machines and pulse oximeters, and those can be very helpful in monitoring conditions at home. Other items that we offer are, we have a line of compression socks and wrist splints. They're medical grade compression. They don't require prescription, but often they can help with heel pain, foot pain, or maybe you got some tendonitis going on in the wrist. We also work with orthopedic doctors and other family physicians and offer a variety of splints and supports in that manner. We have the full lineup of CPAP and BiPAP machines and all the supplies and masks, nasal masks that can go with it. But what we offer specially is our respiratory therapist will take the time to personally help you get the right mask with the right fit, because having the right fit is very important to getting success with that CPAP machine and improving your general overall health. We have a consult room where we can lay you back and get the fit like you would be when you sleep at home. So that is a very important component. We work closely with your doctors to make sure the prescriptions are up to date so you can get your supplies and get them paid for appropriately. We also have home delivery of oxygen. So if the physician orders the oxygen, we can bring you a concentrator in the home, and we also have the portable tanks and other equipment for you so that when you have to go out to the doctor or go see the family or you want to go on vacation, you still can. You're not tied to your home, but you're living comfortable and happy out in the community. Medical Equipment Office works directly with our home care department, and the respiratory therapist will also go out and see our home care patients for their respiratory needs, such as learning how to use nebulizers, learning how to use those inhalers, how to vary those medications to help their needs. That's just one of the many reasons that someone may benefit from home care services. Other reasons that someone might benefit from having home care services are you just got out of the hospital, you had surgery. You know, sometimes when you're in the hospital for so long, and quite often more than not, you become weaker because you've been sitting around in the bed, laying around, you're not feeling well, and then you go home and you're recuperating. And that's where the nurse can come and help do skilled assessments, make sure you're still on the road to recovery. The other portion of that is all the education that you received. How often, you know, we receive paper, but there's so much information in such a short amount of time at the hospital. When you get home, it's very overwhelming. The skilled nurse can come out and help you sort through that and see how that really affects your personal life, how you can adapt it to your own schedule to manage things at home so that you can stay home and out of the hospital. It'd be like if they talk to you about a low sodium diet at the hospital, you can discuss it, but till you get home and open up those cupboard doors and start looking at all of it, that's when it really applies to you personally, and that's when it's really going to make sense on why you got to watch that salt and why you got to watch your weight and see how they influence one another. And that's where skilled nursing comes in. We do the skilled therapies, physical therapy, occupational therapy, and speech in the home, and this can be very beneficial after hip surgeries, any of those type of orthopedic type of surgeries. Other reasons that we may be coming in the home for home care is you need help with complex wounds. We work very closely with wound ostomy nurses and physicians, and we may be having to do wound care 2 or 3 times a week. They may see the doctor 1 day a week and we come out and do it 2 times, or we may be having to help teach the family members how to do those things. We don't ever want you to feel alone in your home, so that's what we're here for. We do IV infusions. We work with a variety of IV types as far as, it could be the peripheral or central line. We do work with the ports. We work with all ages on the IVs. We have pediatric patients, and sometimes we see weekly, monthly. It just kind of depends on what the specialty drug that you need. Another reason that you might get care is medication management. Often we get a lot of medications. We might have 3 or 4 different doctors we're seeing. We end up in the hospital, we come out of the hospital, and now the medications are changed. We're not really sure which one, and not all the doctors necessarily all were on the same page at that time. So the nurse will come and help sort those out and get the physicians all on the same page and help you with that to get you the best management so that you can recover. Both of our offices, Mercer Health Home Care and Mercer Health Medical Equipment, work with a variety of insurances. We can call the insurances, find out if we're in network, out of network. We can work with the deductibles, and if there's ever a question, we just encourage you to call and find out if we are in network or not. Medicare will usually cover home care services as long as it is physically difficult for the patient to get out of the home. And that is very true for the majority of elderly people when they are in the hospital. Some medical equipment is covered by insurances and requires prescriptions. Other medical equipment is more just a cash and carry convenience store item like we carry also.
I'm Natalie Kenny, mother to Carter Kenny. He has MPS II, which is also known as Hunter syndrome, and he receives weekly infusions with services from Mercer Health Home Care, and they've been coming into our home since fall of 2014. Between Cheryl, Lisa, and Amber, we've been getting great care and in the convenience of our hometown. Carter's disease is extremely rare, so being able to do the infusions at home and get the level of care that we get from Mercer Health has been, very comforting to our family. And they take about 4 hours, so the nurses, we just welcome them into our home. We want them to make themselves at home, and it's just a relaxed environment for us to continue his care here at home.
But again, if you ever have any questions, you can call our offices at 419-584-0143 or call 419-584-1973, or you can feel free to visit our website at www.mercer-health.com, and we encourage any questions.